On June 4th, the Wisconsin Department of Health Services clarified that Wisconsin Medicaid will continue to cover the current COVID vaccine for Medicaid members, and that includes children and pregnant women. It also reiterated that they're going to continue to recommend the current COVID vaccine to help protect against illness and help stop the spread of illness. The clarity from the state agency was helpful in light of conflicting statements recently out of the CDC and U.S. Department of Health and Human Services. Most recently, on May 30th, the CDC announced it was keeping its advice that children can get the COVID vaccine while staying silent on guidance for pregnant women. The CDC statements conflicted with prior statements made by U.S. Department of Health and Human Services Kennedy that said he was dropping the guidance that the vaccine should be available for children and pregnant people. And that caused confusion about insurance coverage. And while it remains unclear how private insurance will approach coverage to the COVID vaccine this fall, at least we have clarity on Wisconsin Medicaid. Wisconsin Medicaid will continue to cover the current COVID vaccine for eligible Medicaid members, including children and individuals who are pregnant. In a statement, the Wisconsin Department of Health Services Secretary Johnson said the current COVID vaccine was thoroughly reviewed for safety and effectiveness and continues to be an important tool in preventing severe illness and death. And they said in a press release, while there's changed guidance coming out of the federal agencies, the data hasn't changed. And that's what they're reviewing and basing their recommendations on when they talk to clinical providers in the state of Wisconsin. You can read that statement from the Wisconsin Department of Health Services. We link to it in the description below.